Hi everybody, Dr. V here from AV Dental Associates in Jersey City. I wanted to talk a little bit about dental implant failure. Implants can fail in anybody, a healthy 18-year-old, or at the same token, they can take in anybody, an unhealthy 80-year-old. The reason they fail is because of the unpredictability of the healing process in human body. Medicine is not exact science, and a procedure that works in one person might not work in another person. Now, I'm not talking about improperly placed implants, I'm talking about properly placed implants here. There are two factors that affect implant success: the quality of the patient's bone and also the medical history. If the bone is deficient in quality and quantity, we can augment it by adding extra bone. This is called a bone graft. Adds around 4 to 6 months to the treatment, and also there is still a chance of failure because nothing is as good as patient's natural bone. In terms of medical history, there are certain medical conditions like diabetes that affect patients' healing, and there are certain medications like anti-cancer medications or osteoporosis medications that affect healing. So these have to be considered. Now, one conversation I always have with my patients before they undergo any implant procedure is this. Let's say we place the implant. Number one, are you willing to deal with the post-op swelling, pain, and discomfort after placing the implant? Not everybody gets discomfort, but you're gonna have some discomfort after a surgery. Also, let's say we place the implant and it fails. Are you willing to go through it again, or are you gonna be very discouraged and disappointed? Because if you're not willing to go through it again, or you're very discouraged and disappointed, or you don't want to deal with the post-operative discomfort, implants are not an option for you. You should do a bridge or a denture, but not implants. Don't get yourself into it. Also, time is important. If everything goes smoothly, you're talking about around 4 to 6 months for us to be able to get a tooth in there for you. Now, if things don't go smoothly, it can sometimes take as long as a couple of years, bone grafting, waiting for the healing. So you have to be okay with that too. If you have a deadline, that might not be the best option for you. Also, money is a factor too. Dental implants go from anywhere from $3,800 to $6,000, depending if you need to do sinus lift, bone graft, or any of these procedures. I'm not saying this to discourage you from placing implants. I'm saying this because I want my patients to know everything they need to know about dental implants. Listen, dental implants are the best option for missing teeth. If I lose a tooth tomorrow, I won't hesitate to replace it with a dental implant, but I make an educated decision based on all of this information that I'm giving you. Thanks for watching.